If you have been waking up every single morning for the last year and reaching for a small bottle of medicine, maybe it is a pill called Amlodipine, Losartan, or Lisinopril, I want to ask you a very important question. How much do you truly trust that you know what that little pill is doing inside your body right at this moment? I am not talking about the name on the front of the bottle or the short sentence your pharmacist printed on the paper bag when you picked it up. I mean really understanding it in your heart and in your mind. I want you to know how it works to keep you safe, how it can quietly start to cause trouble if the conditions are just right, and the specific warning signs that tell you the difference between a small annoyance and a serious situation that needs a doctor right away. Most people I speak with are very smart and careful. They are folks who manage their own money and keep up with the daily news. But when I ask them how their blood pressure medicine actually works, they often stop and think for a long time. That pause tells me everything I need to know. It tells me there is a gap in understanding that we need to fill. These are not simple vitamins or mild supplements. They are strong, powerful medicines. Amlodipine, Losartan, and Lisinopril change how your heart beats, how your blood vessels stretch, and how your kidneys filter your blood every single day of your life. Even so, millions of older adults take them on autopilot, never quite sure what to watch for, what to avoid, or when an ordinary-seeming feeling is actually the body asking for help. By the time we're done today, I want you to understand these three medicines well enough that you feel calmer and more in control. You won't be caught off guard. And before we go further, if you find this kind of plain-spoken health information useful, hitting subscribe genuinely helps this channel keep going. We're working toward our first 1,000 subscribers, and every person who joins makes it easier to keep making videos like this one. It costs nothing, and it means a lot. Let me start with a man named Walter because his story shows exactly why this matters. Walter was 74 and had spent his career as an engineer, the kind of person who follows instructions precisely. His daughter had bought him one of those plastic weekly pill organizers, and Walter treated his medicine like a job that had to be done right. When his doctor added amlodipine to his routine, Walter didn't think much of it. He figured it was just another blood pressure pill with a different name. That assumption nearly cost him a year of comfort. 3 months in, Walter's feet had swollen so much he couldn't fit into his favorite shoes. By late afternoon, his legs felt like lead. He stopped his daily walks because moving made the heaviness worse. He was frightened. He told his son he thought his heart was failing, or that his circulation had stopped. He spent hours searching online and only grew more anxious. The real explanation was simple, but nobody had ever sat him down to explain that amlodipine, Losartan, and Lisinopril are not the same drug wearing different labels. Yes, all three lower blood pressure, but that's where the similarity ends. They work through completely different mechanisms with different side effects. Amlodipine is a calcium channel blocker. Picture it telling the walls of your blood vessels to relax and open wider, working on the tiny muscles inside your arteries, so blood moves through with less resistance. Lisinopril is different. It's an ACE inhibitor, blocking a chemical that normally tightens your blood vessels. Stop that chemical, and the vessels stay open, pressure stays down. Losartan is an ARB. It acts on a similar pathway to Lisinopril, but through a different door. This distinction matters more than most people realize, because these are 3 different tools with 3 different risk profiles. Once you understand that, you can stop guessing about what your body is telling you. Walter's puffy legs weren't heart failure. They were amlodipine doing exactly what it's designed to do. In many people, it relaxes the arteries so effectively that blood rushes into the legs, but the veins carrying blood back up don't relax the same way. That mismatch creates a bottleneck, and fluid gets pushed into the tissue around the ankles. Once Walter understood this and talked with his doctor, he was back in his walking shoes within a couple of weeks. Let's stay on that swelling for a moment because it's one of the most misunderstood things about amlodipine. More blood flows into the legs through the widened arteries, but the veins carrying it back don't keep pace. That imbalance raises pressure in the small vessels near your feet, and eventually water gets pushed out into the surrounding tissue. That's why you see puffy ankles, deep sock lines, and heaviness by evening. It isn't because you ate too much salt. It isn't your kidneys failing. It isn't the start of heart failure. In most cases, it's simply a mechanical side effect of how the drug works. The real danger isn't the swelling itself. It's how people react out of fear. Some quietly stop the pill without telling anyone, and their blood pressure creeps back up unnoticed. Others cut back on water, thinking they're retaining too much fluid, which can lead to dehydration, a genuinely risky move on this medication. Others, like Walter, simply suffer in silence and stop moving because they assume the worst. If your legs swell on amlodipine, talk to your doctor. Not because the drug is bad, but because there are real fixes. Propping your feet up, changing the time of day you take it, or switching to something that suits your body better. None of that happens if you don't speak up. If you've noticed this heaviness yourself, drop a comment. You're far from alone. Now to lisinopril and its most notorious side effect, the cough. This isn't an ordinary cough. It's dry, ticklish, produces nothing, and tends to worsen at night. Cough drops and allergy medicine don't touch it. What makes it tricky is timing. Some people develop it within a week, others not for 4 months, by which point they've stopped connecting it to the pill at all. I think of Evelyn, 71, an avid gardener. When her cough started, she assumed pollen was to blame. It was spring after all. She bought air purifiers, took allergy tablets, even had a chest x-ray that came back completely clean. 6 months later, she was still coughing, sleeping poorly, exhausted and irritable, convinced something serious was wrong. When she came to see me, I asked when she'd started Lisinopril. She checked her phone and realized she'd been on it 11 months, and the cough had begun roughly 4 months in. She'd never made the connection. We worked with her doctor to switch her to Losartan, which works similarly but almost never triggers that scratchy cough. Within 2 weeks, it was gone. She'd suffered for nearly a year over something that took 14 days to resolve once the cause was clear. Here's the part that matters far more than the cough. There is one symptom in this drug family that is a genuine emergency. If you're on lisinopril and your lips, tongue, face, or throat begin to swell, you need to act immediately. If breathing or swallowing becomes difficult, don't wait. Don't call the doctor's office for a callback. Don't take an antihistamine and hope for the best. Call for emergency help right away. This is angioedema. It's rare, but it can close off the airway quickly. A dry cough is a nuisance. Throat swelling is life-threatening. Please keep that distinction in mind. Now, Losartan carries its own quiet risk, one that can sneak up even on people who are trying to do everything right. Both Losartan and lisinopril act on a system in the body that regulates blood pressure, and one side effect is a rise in blood potassium. For most people, that stays within a safe range, but add certain everyday choices, and things can shift. Potassium hides in places you might assume are healthy, like salt substitutes. Many replace sodium with potassium. Someone trying to eat healthier by switching to a salt substitute may unknowingly be adding a large potassium load, and combined with a drug that already retains potassium, levels can climb into dangerous territory. That can interfere with the heart's electrical signaling. The unsettling part is that high potassium doesn't always announce itself loudly. It might show up as muscle weakness, fatigue, leg cramps, tingling in the fingers, or an occasional skipped or fluttering heartbeat. Sometimes there's no warning at all before it becomes a real problem. If anyone in your life has recently switched to a salt substitute and also takes Losartan or lisinopril, that's worth a conversation with their doctor. Potassium isn't the enemy. The combination is what needs watching. The same goes for electrolyte powders, meal replacement shakes, and sports drinks. Nobody thinks to mention these because they aren't prescriptions, but they can carry a real potassium load. There's another situation that doesn't get talked about enough. What happens to these medications when you get sick? Not major surgery, just an ordinary stomach bug, a few days of vomiting or diarrhea, or a scorching week where you're sweating heavily and not drinking enough. Dehydration changes how your body handles these drugs. The dose that was exactly right when you were healthy can suddenly be too strong. Blood pressure can drop too low. Kidneys already under strain from low fluid can be injured further. You might feel dizzy, weak, or faint. The medication hasn't changed, your body has, and the drug behaves differently as a result. This is genuinely practical advice. Illness changes the rules. Have a plan in place before you need one. Should you pause a dose during a stomach virus? At what point should you call the doctor? These are questions worth asking at your next appointment, well before you're sick and scrambling. It's one of the most protective things you can do for yourself. If your doctor has ever laid out a sick day plan for your pills, that's a great sign. And if not, it's worth asking for one. Now picture a rough week where your joints ache and your back is stiff. You reach for ibuprofen from the drugstore shelf. You've used it for years. It's sold over the counter. It feels harmless. But if you're taking Lisinopril or Losartan, especially alongside a diuretic, this combination can reduce blood flow to the kidneys, add even mild dehydration, and kidney injury becomes a real possibility. This isn't rare, it happens often, and it's preventable. People don't think of over-the-counter pain relievers as real medicine, but the kidneys don't care where a pill came from. They only respond to the chemistry. If you lean on these pain relievers regularly for arthritis or back pain, it's worth discussing safer alternatives with your doctor. Other medications, physical therapy, and other approaches exist that don't carry the same kidney risk. You don't have to choose between living in pain and taking that risk. Dizziness deserves its own moment of attention too, that instant when you stand up from a chair and the room tilts. Many people grab the wall, wait it out, and assume they just stood up too fast. It happens so often that it gets waved off. But for an older adult, even a few seconds of lightheadedness is enough to cause a fall, and a fall can mean a broken hip, an injury that can reshape someone's life and is often brutally hard to recover from. This isn't about frightening you, it's simply how the body works. The dizziness happens because the medication is doing its job of lowering blood pressure, and when you stand, your heart and vessels need a moment to catch up. For that brief window, blood flow to the brain dips, and the room seems to spin. The fix is often simple. Move slowly. Sit on the edge of the bed for a minute before standing. Hold on to a sturdy piece of furniture. Give your body those extra seconds to adjust. But if the dizziness is frequent, or if you ever feel close to fainting, tell your doctor. The dose may need adjusting, or your hydration may need attention. Staying quiet about dizziness carries real risk, so don't sit on it. One more thing worth untangling: the number on the blood pressure monitor. Blood pressure isn't one fixed value. It shifts hour to hour depending on sleep, caffeine, pain, even nervousness about the reading itself. Talking during the measurement can shift the number. One high reading on a Tuesday doesn't mean your medication has stopped working. One low reading on a hot day doesn't mean it's suddenly too strong. What matters is the pattern over time. Measure the same way each time, same arm, same time of day, 5 quiet minutes of sitting beforehand. Reacting emotionally to a single number leads to bad decisions, taking an extra pill out of fear or skipping one because a reading looked good once. Keep a running log across many days and bring that to your doctor. Let the pattern guide decisions, not a moment of panic. It will ease your anxiety and give your doctor far better information to work with. These medicines are meant to hold a steady level in your body. They aren't like pain relievers you take only when something hurts. Amlodipine, Losartan, and Lisinopril are a constant support for your heart and vessels, not a quick fix, and consistency is part of how they protect you. And one more reminder about dizziness and falling, because it's worth repeating. As we age, the body takes a bit longer to adjust when we change positions. Standing too quickly can cause a brief drop in blood pressure, and that momentary wobble is where the real danger lives. It's often the direct path to a fall, and a fall can lead to a hip fracture that changes everything. That's not drama, that's simply biology. If you feel dizzy, take it seriously. Move slowly, sit at the edge of the bed, hold on to something sturdy, and if it keeps happening, have a real conversation with your doctor about your dose or your hydration. Silence isn't the safe choice here. Home monitoring deserves the same calm approach. A high number on the screen can feel alarming, but remember that blood pressure moves throughout the day in response to tiredness, stress, or even the short walk in from the mailbox. One high reading isn't a crisis, and one low reading isn't a cure. Look at the bigger picture. Sit still, stay quiet, breathe steadily while you measure, and track your numbers over a week or two so a real pattern emerges. That's what your doctor actually needs to see. Don't let a single reading push you into changing how you take your medicine on your own. Trust the process, track the patterns, and keep the conversation with your medical team open. That's what it looks like to manage this calmly and safely rather than reactively. These medications exist to help you live a longer, steadier life, and now you have a clearer picture of how to use them wisely, day after day. If this video helped clear up something you'd wondered about for a while, The most useful thing you can do is hit subscribe. This channel is working toward its first 1,000 subscribers, and each new subscriber helps this kind of straightforward health information reach more people who need it. Drop a comment with your own experience, share this with someone who takes one of these medications, and I'll see you in the next one.